Hi, this is Jennifer with your Dental Minute at Dr. Pamela Marzban's office. I'm here to talk to you about oral cancer screenings, and what we have here is called a Velscope. It looks like a fancy flashlight, but what this does is we always do our visual oral cancer screening. We check all tissues underneath the tongue, everywhere that oral cancer can be present. And what this does is this allows us, we recommend this about once a year, unless there's a family history or other things that we feel like it needs to be monitored more closely. And then we recommend it each time. It has an ultraviolet light, which allows us to penetrate down underneath the tissue where our eyes cannot see and where it would be very, very difficult, if not impossible, to spot any types of changes in the oral tissues that can mean that oral cancer is present or starting to form. And what it does is it reflects healthy tissue, reflects the light back. When we look through our filter, we see a green glow. If we see anything that is kind of gray to black, anything that's dark, that allows us and alerts us to look at that area more closely to determine, hey, is this inflammation? Is this just something that's been trauma? Or is this something that needs more attention and to be monitored more closely, or possibly to be sent out to be biopsied by an oral surgeon? It just allows us to check more closely to see and detect oral cancer screening earlier, because the earlier, as with any cancer, the detection, the earlier the detection, the better the prognosis. And oral cancer screening, oral cancer can be very, very serious. And the treatment, it can be very, very difficult. So this allows us to do more and see more a lot earlier. And the risk factors for oral cancer screening is still the same: smoking, drinking moderately to heavily, things like that. But where we're really seeing the increase is with the HPV virus. So that one can go undetected, and that's why we're seeing it in kids and teenagers and young adults, is where that rise in oral cancer is, because of this HPV virus. So we really even recommend starting this in the teenage years, where you can be exposed to the HPV virus, so that we can also not miss out on these groups of people who can have those higher risk factors.